Today, we live in a world where we can replace hearts, we can cryogenically preserve people, and we can make the immobile mobile again. But despite this, we actually know less about the brain than we do the dark surface of the moon. But what if it didn't need to be this way? What if there was a simple yet effective way of obtaining a quantified means of baselining what's normal for you? What if we had a cost-effective and timely mental health assessment which was as comprehensive as, say, a physical health check? Well, the evidence that I'm seeing from the World Economic Forum, Gartner's Emerging Tech Trends for 2020, and even Forbes are all pointing towards a very interesting neurotechnology-enabled future. So what might this look like? Well, my name is Aaron Sherwood, and in this video, I'm going to be talking about the next frontier of human-computer brain interfacing. So here goes. Now, in the mind of Elon Musk, even the world's thorniest problems can be made remarkably simple. And maybe in the very near future, Elon Musk's Neuralink announcement, which was, a few weeks back, we'll all be learning new languages or controlling our smartphones, even playing computer games in a very, very different way to what we do today. And I'm sure that many of you who watched that Neuralink announcement thought, blimey, this is utterly quite terrifying stuff. But well, what we're actually seeing is a trend towards a more intelligent means of understanding the brain. Now, the world really has come on leaps and bounds when it comes to computer vision, image analytics, apps, and even the wearable technology space. And all of these technologies are really beginning to disrupt many sectors, reimagining what the future of workplace mental health really might look like. And I know this because over the last few months, I've been speaking to a number of leading companies operating in this space and really understanding more about what their vision is for the future application of these technologies. And here's just one application and one example of one device that I've been trialing with a company called Wavi. Their device really caught my eye because literally within a few minutes of having this wearable device on your head, you can get a really detailed and accurate picture of a mental health assessment with a really comprehensive data sheet. And that detailed all the different brain measurements and data points specific to me. But it was from this that really got me thinking about the existing technology landscape and how that could be taken just that little bit further with technology just like this. Take Caterpillar, for example. They've already implemented a 24/7 facial recognition fleet monitoring system, which measures things like mental fatigue and performance variability for those in, say, the construction or long-distance freight movement industries. But what if this was complemented with a wearable or even a voice technology which provided a mental health assessment tool which really understood the mental impacts of things like loneliness or fatigue over time? What if there was a mental deterioration warning or bespoke care package built specifically and carefully around that driver? The military space, for example, is a really interesting area for the application of this sort of computer-brain interface technology. If you're thinking about quantifiably baselining what's normal for a soldier, for example, you could potentially hyper-personalize mental health programs built specifically around their needs. Could you minimize things like the susceptibility of getting PTSD out in the field? Could they build a more resilient workforce through more sort of biologically, digitally enabled mental health assessments? In fact, DARPA, which is the US defense organization I've mentioned in my previous videos, they've already built what's called a systems-based neurotechnology for emerging therapies. And what they've done is they're looking at implanted devices for therapeutic systems and treating and even possibly curing neuropsychiatric illnesses. But what if this technology began to reinvent modern psychometric testing, for example? Could you assess an individual's capability or organisational readiness in a much more intelligent, data-driven way? What if we could digitally map the synapses of the brain to understand the effects of certain products like alcohol or tobacco and intelligently personalise these based on an individual's biosignal data? Could you potentially make these products even safer because they've been uniquely built to an individual's biological needs? In my opinion, that could be a complete game changer when you think about the world of clinical trials and even rapid prototype development. So there's no denying the fact that there's so many unanswered what ifs and questions. And for this technology to really become mainstream, I think that those working in this space will inevitably at the moment be facing a number of ethical hurdles which they've really got to overcome. But ensuring this technology is used in the right way, with the benefit case clearly articulated, with sufficient regulatory frameworks and safety guarantees, will really be required before this slight biohacking trend can really go mainstream. So that's it for today's YouTube video. I hope you've enjoyed it. Thanks again for watching. Don't forget to like, subscribe, give me a thumbs up, and I'm really looking forward to speaking to you in my next video. Bye for now.